Helping women prioritize their health. September is, of course, the prompter is going to completely stop right here when I've got the mouthful. Gynecological Cancer Awareness Month, and this morning we are spotlighting the signs and the symptoms and the treatments that are available. So joining us for this discussion, Dr. Thomas Morrissey, the Director of Gynecologic Oncology at Lynn Cancer Institute, which is part of Baptist Health, South Florida. Thank you so much for being with us. I really appreciate it. You know, a lot of women watch this show, so I think this is a really important topic. Talk about some of the types of cancers that you see on a regular basis and some that the female audience needs to know about.
Great. Thanks so much for having me. Yeah, the main cancer that we deal with in gynecologic oncology are endometrial cancer, which is cancer of the uterus, cervical cancer, and ovarian cancer. And so those are the main ones that we would deal with that we take care of. Okay,
so talk about some of those. Caught early and being screened on a regular basis. Is it something you feel like women can beat?
Yes, I mean, obviously, you know, catching any cancer early is what we aim for because there's a much better chance of cure and successful treatment in that situation. As far as the symptoms that we look for with patients with cervical cancer, it would be bleeding or discharge or irregular bleeding. For endometrial cancer, it's usually bleeding in patients who are postmenopausal. So patients haven't gotten their period in a few years, and all of a sudden their period comes back. It's not a comeback; it's a symptom that they need to have checked out, and that's often how we catch those cancers early. Ovary cancer is tricky. There's not really an effective early screening test for it, but some of the symptoms that people have are abdominal bloating and some changes in their bowel habits and things like that, which are pretty nonspecific, and most of the time aren't ovary cancer, but need to be checked out to make sure.
HPV vaccine, really kind of a game changer in your world.
Yeah, so the cause of cervical cancer, almost all cervical cancers, is HPV infection, which is very common. About 80% of people in the population have been exposed to it. Most people don't get cervical cancer, but people who have a history of HPV infection are at higher risk. When we do screening tests now with Pap smears, we check for HPV infections as well, and that helps us triage who we need to watch more carefully.
And that's something that younger kids actually start with the vaccine.
Absolutely. So vaccination is highly recommended. It's highly effective for prevention of precancerous changes and cancers in both girls and boys, but obviously the girls to prevent cervical cancer, vaginal cancer, and genital warts.
And if can the boys get the vaccine because they spread it?
Well, that's part of it, but that also can reduce the risk of anal cancer and penile cancer, which is a lower risk, but again, it's very effective at preventing those things as well.
And talk about screenings. What's recommended as far as going to your annual visit? When do you get some of these tests?
Right, so for Pap smears, that's changing. Usually we do Pap smears every 3 to 5 years now for people who are between age 30 and 65.
I feel like it used to be every year. Is that changed?
Yeah, it's changed due to the HPV testing and vaccine. Okay. So again, if you're HPV high risk strain negative, those patients are at lower risk, and so we usually only need to screen every 3 to 5 years now.
All right, I'm not complaining. I'm just
saying.
Thank you. You know, sometimes an awkward topic to talk about, but it's definitely something that the women in our lives all need to talk about. Should be getting those screenings each and every year. Thank you so much. We really appreciate it. If you like more or like to watch this interview again, you can go to our website, WPBF.com, or download our free mobile app. Doctor, thank you.
Thank you.